Hi, Dr. Dave Webster, and this is part of my video blog series about the travesty of patient access to PET-CT in the Ontario Liberals' so-called evidence-based patients-first healthcare system. And this video is just really a heart-to-heart chat between myself and Dr. Hoskins, our Minister of Health. So, Dr. Hoskins, this is between you and me. We are both physicians, and as part of our becoming physicians, we had to take something called the Hippocratic Oath, which in part says we should first do no harm to our patients. Now, I'm quite prepared to publicly offer up my advocacy for patients in Ontario regarding PET specifically as an example of that. The question is, Dr. Hoskins, are you? So as physicians, you and I have both experienced what it's like to be with families and patients who are terrified of their illnesses and their investigations are going to have to undergo, as well as treatments, in the hope that they will survive their cancers. But you were also the first Minister of Health in Ontario who is a physician. The whole process started with Mr. McGinty and his bulldog, Mr. George Smitherman, but they had no medical knowledge, the various predecessors for you. So perhaps they could be excused for not fully understanding the complex medical and research issues, but most importantly, the impact on patients who do not have proper access to PET. But, Dr. Hoskins, you do have the full knowledge of every aspect of the medical nuances and the issues related to PET imaging. You also, of course, have full access to the extensive scientifically based medical literature documenting the many uses and benefits of PET-CT, not just for cancer patients, as you know, but for those concerned about dementia, head injuries, cardiac patients, and many other things where this has been the standard of care for many years. But most important of all, Dr. Hoskins, you have the power as the Ontario Minister of Health to bring about the kind of changes that would actually finally allow Ontario patients access to the era of personalized medicine, and which in some countries, of course, has been there, as you know, for up to 25 years. Yet, you have deliberately chosen not to allow our patients access to not just a far more effective imaging management tool for their serious illnesses, but one that is far more humane, safer, more compassionate, and actually is truly patient-focused, that in fact, if you introduced properly, would cost considerably less to Ontario's taxpayers. And yet, to defend the Ontario Liberals Party is their vision for Ontario patients, you have repeatedly made statements to the media that range from the laughable to quite simply blatant alternative truths. Further, you are aware of and condone the threats being made against me by the senior executive of Cancer Care Ontario because I have dared act as an advocate for my patients against them. So as you know, if I continue to give physicians and patients access to the facts and documents as to how Cancer Care Ontario has assessed PET, or if I use case examples to demonstrate the terrible and cruel consequences for our patients, I stand to lose my privileges as a physician. Now, as you know, of course, I'm just the messenger, and I'm simply making available to the physicians and patients the facts and medical literature regarding the actions of your expert medical advisors. But I've naively imagined that we actually still live in an open, transparent, and accountable system of democracy, where, remember, the mission statement of Cancer Care Ontario is about being transparent and accountable for their actions to Ontario's patients. Now, I've just sent my response to the College of Physicians and Surgeons of Ontario to defend myself against Cancer Care Ontario's accusations. In fact, I've used the CPSO's documents to, I believe, validate and show what I'm doing is actually correct. Now, I'm going to quote from that letter, and I apologize for having to read this, but my strength is not in acting and memorizing lines. But the professionalism policy states that a, quote, physician's primary responsibility is to act in the best interest of the individual patient, end of quotes. I care deeply for the needs of my patients and indeed all Ontario's patients. In advocating for PET access in Ontario, I believe I embody the key values and professionalism articulated in the college's practice guide, and that includes compassion, service, altruism, and trustworthiness. I also believe that I am upholding the reputation of the medical profession by first and foremost always acting in the best interest of my patients. So yes, I am determined and proud to stand up to you, Dr. Hoskins, and those of your colleagues who are making critical decisions affecting Ontario patients, not based on the accepted methods of science and medicine, but as you know, you're using a scientifically baseless and unethical and immoral, politically motivated agenda, which you have directed squarely at some of Ontario's sickest and most distressed patients. And this assault on our patients, all because you and your Liberal colleagues are not prepared to stand up to powerful medical self-interest groups who stand to lose significant income if PET were properly introduced in Ontario. Yet, in spite of the unprecedented accusations and condemnation by Canadian and international medical experts about what your Ontario Liberal Party and their medical experts have and continue to do to patients, you, Dr. Hoskins, our Minister of Health, Ms. Wynne, our Premier, and your golden boy, Mr. Glenn Thibeault, my Sudbury MPP, are very proud of the fact that Ontario's patients have the most restricted indications for PET-CT in the world. But worse, you are happy to force Ontario physicians to investigate our patients in a manner that could lead to charges of incompetence or worse. Why is that? Because, as you know, your Cancer Care Ontario standards of care forced on Ontario physicians can and does lead to unnecessary risk, harm, stress, and premature death of our cancer patients. So, Dr. Hoskins, see this? As you probably know, this is a number 19 Chiba biopsy needle. I don't know how well people can see that in the background there, but this is the needle we use to do lung biopsies. So let me pass on to you, Dr. Hoskins, what a very disillusioned and frustrated radiology colleague said to me about 10 years ago when he was going to have to stick this needle in a woman's chest with a lung nodule. He said this: David, I know that this woman needs a PET scan, and at any other medical jurisdiction offering PET, she would have already had one. Why? Because it would have allowed us to determine whether in fact she needed me to stick this needle in her chest in the first place, but more importantly, that if we have to stick the needle in the chest, it would be the best way of determining what is the most likely spot to put this needle so that I would get a good result for the pathologist, and above all, be the safest and least stressful for my patients. But because this patient lives in Ontario, I need to stick this needle in her chest first before she will be allowed this critical PET scan. And he said, this is terribly wrong. So, on the other hand, you and your medical experts and my colleague and friend are forced, what you do is you force us to do this. And for you, this is the very essence of what you mean by the Ontario Liberals, evidence-based, patients-first healthcare. So all things considered, Dr. Hoskins, my colleagues and I and my patients, we really have left us with no choice but to conclude that you want my terrified 83-year-old patient described in a previous video to have this needle stuck in her chest and had the consequence of a pneumothorax, a collapsed lung, had significant pain and shortness of breath, chest tube inserted and so on. You wanted that chest tube to be inserted and in hospital, weeks recovering. You were not the least bit concerned that this was not even necessary to stick this in her chest, and that to add insult to injury for this patient, the biopsy came back negative. Why? Because the radiologist could not possibly know where the best spot to put that needle was, and of course the safest. So after all she went through, her physicians still don't have a proper pathology sample so that her physicians can most effectively plan her therapy. But not only does this not concern you, it in fact is your goal to have this happen. And you have stated how very proud you are of your medical experts who have come up with the agenda-driven evidence to ensure that this would happen to this patient and patients in Ontario on a daily basis. So, Dr. Hoskins, you really do fully understand the consequences of this for my terrified 83-year-old female. So what I'm asking is, just what is it that you are so proud of in offering up as your liberal vision of evidence-based, patients-first healthcare? So, Dr. Hoskins, the ball's back in your court. So for those continuing to watch my video series, what I'd ask you to do is consider going to my Facebook issues page called Pet Scanning Issues in Ontario. I have a video blog where all these videos are up, and it's called Dr. Dave Webster. As you can see here, Dr. Dave Webster, funny way of putting it, and then you go to the video page where they are, and I will shortly be having my Twitter account up, and I do hope to have a website up very shortly. But remember, social media does give us the power to finally end the Ontario Liberals' agenda directed against our patients. We really do need to make this a key election issue. If we don't, as you can see, Dr. Hoskins and his medical experts will continue to be able to get away with this for our patients. So my next video is going to continue on what I started before about the, quote, safeguards in Ontario, the Ombudsman. I've already given a couple of videos on that. I'm going to now continue on that series looking at my interactions with the Ombudsmans of Ontario. So thanks very much for your supportive comments and so on. Let's make this an election issue. Thank you.